Good morning. We have now the theory, little theory, about the part of the book that deals with post-operative pain. Okay? We're going to have one problem on the next exercise, but let me give you a few points here of what we're looking for. Okay, now when you go to have an operation, right, you have pain. After the operation, after the effects of anesthesia are gone, there's pain. Now, if there's regular pain, every operation comes with regular pain. Do we code that? No. That's why when the pain is routine, we don't code it. Okay? Now, if the pain is acute and very strong, do we code that? Yes. And there's a difference. There's a difference between acute and chronic. Acute means that there's a pain that comes all of a sudden, right? And chronic would be that the pain is still there and goes and goes and goes on. That's why we have to make a difference between acute and pain. And chronic, acute and chronic pain. All right? That's the second point. The third point is, when do you experience the pain? If you have been discharged from the hospital and then you experience pain at home and you come back to the hospital and are admitted because of the pain, that means that the pain has to be coded as primary diagnosis. That is primary diagnosis. Right? Now, if while you're still in the hospital you develop the pain, right, then that is not a primary diagnosis because you weren't admitted to the hospital because of the pain, but you develop the pain while you're still in the hospital. That's called secondary diagnosis. Would be this part. Okay, those 3 points you have to take present. Now, when you code post-operative pain, there are 3 codes that you have to have. The main code for post-operative pain is just one code that tells you whether it's acute or chronic and describes that it's a post-operative pain. Then there has to be another code for the site. Where is the pain? Is it in your lower back? Where are you feeling the pain? And the third code is the cause. What caused? What kind of operation did it cause the pain? So once you have these 3 codes, then you have coded that post-operative pain. Okay, now as usual in the theory, I'm going to point to you to the theory in the book, and Stephanie is going to try to catch a shot so you can pause it and read it, and then we have the flashcards for you to exercise. So follow me here to page 210B, 210 and B, the B section, and can you take a shot to the page so they can read, pause it and read it. Okay, and after you have done that, I'm going to take the camera and Stephanie is going to go to the website where we have the flashcards, and we're going to do the flashcards. Okay?
Ready.
Are you ready? Okay, now the flashcards is first I ask the question, and the question is in the Jeopardy style. There's the answer is just one letter, like in this case is A, and then you have to guess what the answer is. We give you a couple of seconds and then we tell you the answer. That way you can practice over and over, okay? So I'm going to read the first 3 questions. Post-operative pain is classified to the subcategory of G89.1, of course this is in ICD-10 CM, if the pain is A.
Acute.
Okay, second question. Post-operative pain is classified to the subcategory of G89.2 if the pain is C.
Chronic.
Thank you. The third one. If post-operative pain is not identified as acute or chronic, assume that it is A.
Acute.
Okay.
My turn.
Now, Stephanie.
4. After the general code for postoperative pain, you have to specify the site and the C.
Cause.
5. If the patient is admitted for postoperative pain control/management, the postoperative pain is the PD.
Principal diagnosis.
6. If the patient presents for outpatient surgery and develops an unusual amount of postoperative pain, this one is reported as a SD.
Secondary diagnosis.
7. Routine or expected postoperative pain immediately after surgery should not be C.
Coded. Okay, those are questions in the flashcards, and then we end this video by inviting you again to visit our website. Thank you.